Welcome, everyone. I'm Debbie Leone. I am the Information Services Manager for the Epilepsy Foundation of Minnesota. And on behalf of EFMN, I want to thank you for joining us for our Wellness Wednesday webinar. Tonight's topic is Sudden Unexpected Death in Epilepsy, or SUDEP. We are grateful to be partnering tonight with the Epilepsy Foundation of America, our national organization, to address this difficult and challenging but very important topic. Couple of things I want to go through and talk a little bit before we get started about EFMN a little bit. So in addition to our webinars, EFMN offers a range of programs and services that provide support, education, and connection to those who are impacted by epilepsy. And many of you may be familiar with our summer camp programs, which include Camp Oz, which is our one-week traditional camp experience for youth ages 9 to 17. And then we also have day camp that is for younger kids to help them just get prepared for attending overnight camp. And then we have family camp for those who have additional physical, social, or emotional needs. We also have virtual connect groups, and this is a monthly space where individuals impacted by epilepsy can meet others on a similar epilepsy journey, and they can share experiences and peer support. And we have connect groups for a number of different audiences, including adults with epilepsy, parents and caregivers of children with epilepsy, young adults, teens, and those with a rare or complex epilepsy diagnosis. And then we have a quarterly connect group for those who've lost someone to epilepsy, who've lost a loved one. And then occasionally we offer some customized connect groups for specific audiences, and we do those as the need arises, as a way to respond to the epilepsy community's needs. We have education services, which includes these webinars, as well as seizure smart trainings for schools, for workplaces, for social service organizations, for healthcare facilities, and really just about any place that can benefit from some seizure training. We have an information services department, which is what I do here at EFMN. And through that, we provide individuals, caregivers, and professionals with information and resources on a wide variety of information about epilepsy-related topics. And that's all done through free one-to-one customized support. We have a Shining Star program, and that's for all youth with epilepsy under the age of 18. And that includes connection opportunities for youth, support resources for their families, and epilepsy awareness opportunities for the families and their communities. Because we know that epilepsy can be isolating, our social events are offered to bring together all types of people affected by epilepsy to connect, to share experiences, and just to have some fun. These events happen throughout the year, and they vary by region of the state to meet the local needs. We have Advocacy department, and our advocacy efforts really aim to shape policy at the local and state levels with the goal of making Minnesota a better place for those who are living with epilepsy. And then finally, our donated goods service. That operation plays a really key role in serving the epilepsy community in Minnesota, because donations of clothing and household items help to fund our programs and services. So information about where we offer free pickup of those clothing and household item donations, as well as drop-off bins, can be found on EFMN's website. We have a number of great events happening over the next month, and I am not going to go through each and every one of these, but just note that there are a number of connect groups happening over the next month. We also are doing Season of Giving events, where this is a chance to get together with others impacted by epilepsy, share dinner, share some conversation, and do either, depending on the location, do crafts or card making or blanket making, and then some of the things that are made will then be donated to long-term care facilities, to the residents there, or to Gillette Children's Hospital. So we're excited about offering those in several of our communities. And then in November, we're also going to have an advocacy listening session. And this is really a chance to talk about what some of our legislative priorities might be for the next year for 2023. So we really hope that you'll join us for one or more of these events, and the details about each of them and registration links are available on our website calendar at epilepsyfoundation.org/events. A few housekeeping items before we get into the meat of the webinar. The webinar will last 1 hour and 15 minutes. In order to have the best experience, we encourage you to close out any windows that might be using up a lot of bandwidth, especially things like screening or streaming services or music applications. We will provide you with a certificate of attendance that will be sent within 3 business days in a follow-up email. And in case you're wondering if you need to be madly taking notes tonight, we are going to send out the PowerPoint slides for this webinar. So you will have that available. That will go out to you along with your certificate of attendance. The webinar is being recorded, and we will post a link to that recording on our website, on the EFMM website, for future viewing. So if you know someone who wasn't able to come tonight, make sure that you let them know that this will be available, because this is really good information we don't want people to miss. You will notice that we have closed captioning activated. If you don't want to see captions, you can click on the CC icon at the bottom of your screen, and there you can choose to hide those subtitles. We do encourage you to ask questions, and you can do that during the webinar by clicking on the Q&A icon you should be able to find at the bottom of your screen. That will bring up a box where you can type in your question, you can hit send, and we're going to save those questions till the end. We have allowed time at the end of the webinar for our speaker to answer as many of those questions as we possibly can. Our speaker will not be able to offer medical opinions about your or your loved one's risk or concerns around SUDEP. For that reason, and to respect everyone's privacy, please keep your questions as general in nature as possible and not specific to any one individual. You can also use that Q&A box to let us know if you're having any kind of technical issues. My EFMN colleague, Kenzie Mabron, is here with us off camera, and she will be there to help if you do have any of those types of technical issues. And to avoid confusion, the chat feature has been disabled. So if you need to communicate with us, you'll need to do that through the Q&A feature. So let's move into our objectives for tonight. The first is to understand what SUDEP is, its possible causes, and the populations who are at highest risk, to identify strategies for lowering individual SUDEP risk, to learn effective approaches for discussing SUDEP risk with your medical provider, and to explore resources available for those who've lost someone to SUDEP. So I am excited now to introduce you to our speaker for this evening. Allison Kukla, MPH, is the Senior Manager for Programs and Partnerships at the Epilepsy Foundation, where she provides leadership for the Foundation's SUDEP activities and bereavement support services. She also supports dissemination of epilepsy self-management programs and establishes and maintains strategic national partnerships. Allison is a public health professional with demonstrated success in coalition building, campaign management, and engagement strategy development in a variety of fields at the local, state, and federal level. She has a Master of Public Health in Prevention Science from Rollins School of Public Health, Emory University. Allison is also a person with epilepsy, an epilepsy advocate, and former staff in the Obama White House and US EPA. We are thrilled to have her here with us tonight, and I will now turn things over to Allison.
Thank you for having me, Debbie, and for that kind introduction, and welcome everyone for joining us tonight. As Debbie shared, my name is Allison Kukla, and I'm a Senior Manager with Programs and Partnerships at the Epilepsy Foundation of America. And part of my role is leading our bereavement services and providing leadership for our SUDEP program, which is why I'm here tonight to talk with you more about understanding sudden unexpected death in epilepsy, or SUDEP. You can go to the next slide, please. And first things first, as Debbie had mentioned, this is a pretty difficult topic, and it's important to acknowledge that. And I wanted to make sure that we acknowledge that at the beginning of my talk tonight. oftentimes the risk of SUDEP or dying from a seizure can be like that elephant in the room. I work with many in our community who want to talk about it with their healthcare team or talk about it in general. They don't know how or don't know how to bring it up. I work with bereaved families who have never heard about it before until their loved one passed away from SUDEP, and they really wish they had heard about it prior and learned about the risk. And I work with healthcare providers who are champions for talking about SUDEP with patients, and they work to educate other providers about why it's important to talk about it. And my hope after tonight's presentation is that you'll be more comfortable talking about SUDEP and you'll leave tonight with more information that'll help make you more comfortable and knowledgeable about talking about SUDEP. We go to the next slide, please. And, as we were saying and Debbie was saying, people want to know about SUDEP, which is why we're doing the webinar tonight. And many studies have been done showing that this is the case. It's not just people with epilepsy who want to know, but it's our caregivers, it's our loved ones, our family who want to know more about SUDEP and the risk that comes with SUDEP. On the slide here, you can see some studies that show that being the case, that people want to know about SUDEP. In one of the studies, you can see in that first bullet, both adults with epilepsy and their caregivers who are worried about, people with epilepsy and how they could possibly die from a seizure wanted to know more about SUDEP. You can see it was about, 44 to 62% for adults with epilepsy and even higher for caregivers. And then in a UK study there in the third bullet, it showed 91% of UK parents wanted to know more about SUDEP. And then, as I shared, it's also people who have lost someone to SUDEP. They wish they had learned about it beforehand. And the study there in that last bullet showed that 72% wished they knew about SUDEP prior. So this is a reason we're doing the webinar tonight and we're educating about it because we want more people to know about it so more people are comfortable talking about it and that awareness and education gets out there. Go to the next slide, please. But before we, dive deeper into SUDEP, I want to make sure that we look first at mortality and epilepsy in general, since there's other forms of epilepsy mortalities, and I want to make sure we cover that just briefly too. So when looking at all people with epilepsy, there's more likely to we're more likely to have an early death, and there are some predictors for this. So you can see on the slide there just a few of those predictors for that early mortality. It's ongoing seizures, those uncontrolled seizures. If someone's epilepsy is due to a known brain disease or disorder, not following the recommended treatments that we might get for our seizures. So, missing medications or not following up with doctor's appointments and staying on top of those treatments. And then also, seizures that are not able to be controlled by medication because it's those ongoing seizures that kind of put people in that higher risk. Go to the next slide. So when looking at mortalities in epilepsy, the chart here on the slide shows the classifications for epilepsy-related deaths can be broken into 4 main categories. 2 of the categories are really what I want to highlight tonight are the unnatural deaths in epilepsy and the deaths due to epilepsy. With unnatural deaths in epilepsy, those can include motor vehicle accidents or other accidents, accidental medication overdose, suicides, drownings, to name a few. And when you think about those deaths and look at those deaths, it's important to highlight the need for good mental health screenings, mental health supports, and education around suicide, taking your medications properly, because it can assist with preventing those deaths. And it's also important to think about counseling on driving and water safety for people with epilepsy, because it could also help to prevent some of those unnatural deaths with drowning and, proper driving. And when looking at deaths due to epilepsy, are, a direct consequence of a seizure. And some of those can include, you can see in the chart there and on the slide, again, drowning, status epilepticus, and SUDEP, which is what we're here to discuss more tonight. So if you go to the next slide, we can talk more now about, what is SUDEP? So as I said earlier, it stands for sudden unexpected death in epilepsy. And it was originally defined back in 1997. And you can see that definition there on the slide, and kind of the three different ways to, kind of think about SUDEP. You have, it's a definite SUDEP when an autopsy is done and can prove that it was a definite SUDEP because there was no other cause of death. It was a probable SUDEP, an autopsy wasn't done, but there's no other cause that, caused that death, or it was a possible one. There was some possible other cause of death, but, the data is kind of lacking, but it was still probably a SUDEP. So that's how SUDEPs are kind of defined in that first definition. And then in 2012, the term was updated to provide a more unifying definition and make it a little more specific. And that definition now has really helped facilitate research since it's more detailed, and has helped really, moved SUDEP research forward, which has been really helpful in the field. And some other key things to think about with SUDEP and, kind of understanding more of, what is SUDEP? The deceased person is a person with epilepsy, and the death was unexpected and sudden. The death may or may not be witnessed for it to be SUDEP. Evidence of a preceding seizure is not necessarily required for it to be considered SUDEP. And also, post-mortem examination or autopsy does not reveal a cause of death. So it's a lot of information, and the definitions can be a lot, but there are many things that are included when talking about SUDEP and defining what is SUDEP and what is considered a SUDEP death. And so with the next slide, we're going to look at incident rates. And I'm sure many people have probably heard the incidence rates for SUDEP are 1 in 1,000 people with epilepsy will pass from SUDEP per year. And it was previously thought the rates were different between adults and children, but studies have shown that the rates are about the same for these populations. The chart shows these two studies outlining SUDEP rates across different age groups. You can see on the slide here, the studies were done in Sweden and Canada, and the definite and probable SUDEP populations for the different age groups. And both studies show, you can see in that second column, that with all of these age groups, the rates were that 1 in 1,000 per year. So because of these studies, we can now say pretty conclusively that SUDEP does affect 1 in 1,000 per year, and that adults and children are affected equally. But let's dive a little bit deeper into that rate. And if you go to the next slide, thank you. SUDEP is the most common cause of early death in people with epilepsy. And when seizures are uncontrolled, the rate does increase to 1 in 150. So you'll see a theme throughout the talk tonight that it's that uncontrolled seizure that does increase someone's risk for SUDEP. And we'll talk about that more and how you can reduce your risk. But looking at, what groups are affected by SUDEP, it occurs, in newly diagnosed and those who have lived with epilepsy for many years. It's in both populations. Some studies have shown a higher rate of SUDEP in African-American men, but not a lot of studies have been done looking at different race or ethnicities around SUDEP, because studies are really being done, as I showed previously, around ages to see if there was a difference. And as I previously mentioned, the rates have been shown to be the same now in adults and children. And then, we want to talk also about possible causes. So SUDEP occurs most often at night or during sleep when the death is not witnessed. Because as I said, it can be witnessed or unwitnessed. And, if it's not witnessed, that's going to leave many questions unanswered about what happened. There may be evidence that a person had a seizure before dying, but this isn't always the case. So a lot is still unknown about SUDEP, but many areas are being looked at and researched to see what is a probable cause. So current research, you can see on the slide there, into possible causes of SUDEP focuses on problems with breathing, heart rhythm, and brain function that occur with a seizure. So you can see with those bullets, kind of more specifically what they're looking at with those three areas, because it could also be a mixed cause with those areas or other things. But a lot of research, as I said, is being done in these areas to find more conclusively what are the causes of SUDEP, because right now there's not, a really specific answer on what causes it, unfortunately. So research is very important in this area, and a lot is being done to find out, what causes it, how can we reduce our risks for SUDEP. So I want to talk about one research area that's being done on the next slide. It's called the North American SUDEP Registry, or NASR. It was started in 2011. It's an international group of researchers that collaborate, and they're dedicated to uncovering risk factors and causes of SUDEP because they want to improve future epilepsy treatment and SUDEP prevention efforts. They do their research by reviewing medical records, conducting interviews with bereaved families and individuals, and conducting research on donated DNA and brain tissue to learn more about what happened during a death and see what they can find out from the person that had died. This study here on the slide was done in 2019 and shows just a little bit of what they've learned so far. And, through their research, they've been able to identify 237 definite or probable SUDEP cases and connect them to different types of epilepsy you can see there. But as I've said, a lot is still unknown. So you can see there's a lot of unknowns connected to the research, still trying to learn, what caused those deaths and everything. So they're still doing a lot of research to, learn more, but they have a lot of other conclusions that they've reached as well on the next slide that I want to share, because they're doing amazing work that is really, changing the field here. And we're learning a lot about SUDEP from what they're doing. So on the next slide, you can see that, a lot of what I've already shared, and we're going to, talk about more, but that, SUDEP can occur even if you're seizure free. You don't need to have a seizure. It can happen for non-tonic-clonic or tonic-clonic seizures. And also if your epilepsy is benign. It can occur despite taking your medications, co-sleeping, or if CPR is administered. And therefore, because of all of those things, it needs to be discussed with everyone. And I will emphasize that throughout my talk today, that it needs to be discussed with everyone. And it's important that you manage your epilepsy really well and try to, stop seizures as well as you can, if that's, modifying certain things in your life to stop seizures, if you're able to identify triggers to, get better sleep and things like that. I know I think about that as a person with epilepsy. What can I do to, get better sleep, which is a trigger of mine. So those are some of the things NASR has learned in their research that they help educate the community about to, help people lower their risk for SUDEP. And we're going to dive deeper into some of those. We're going to talk more now, move to the next section about SUDEP risk and risk reduction. So on the next slide, here are some risk factors that have been identified in studies over the years. And you can see at the top there, GTCs, or generalized tonic-clonic seizures, having 3 or more per year has risen to the top as, the highest or the greatest risk factor for SUDEP. You can see some others that are listed on the slide there, but that's really the greatest risk factor that has been identified for SUDEP. People that have ongoing uncontrolled tonic-clonic seizures. Also, another that has been identified are people with nighttime or nocturnal seizures may have a higher risk. And as I mentioned earlier, not following your treatment plan. So missing medications or not taking seizure medicines as prescribed because it could lead to more seizures. So again, that theme of those uncontrolled ongoing seizures may put people at a higher risk for SUDEP. But it's really that ongoing uncontrolled tonic-clonic seizure that is the highest risk. And then the next slide also talks about some of those risk factors. This study was done just in 2020 and shows some of those clinical risk factors. And they looked at a population-based study. And you can see here is similar to what was just discussed on those risk factors and shows how a person's risk for SUDEP increased depending on their seizures and lifestyle. So you can see the generalized tonic-clonic preceding the previous year, if they had them, increase their risk by 27%. People with no generalized tonic-clonic seizures didn't have an increased risk for SUDEP. Nocturnal or nighttime seizures, generalized tonic-clonic seizures increased the risk by 15%. And then not sharing a bed and having generalized tonic-clonic seizures increased someone's risk as well. So those were similar to the previous study that I shared. Those risk factors can increase someone's risk for SUDEP. So as I said earlier, this is a very difficult topic to discuss, and sharing about risk factors and everything. I don't want anyone to leave this webinar worried or stressed or scared. So I want to spend time to talk about, how can you reduce your risk, or, what are some tips, or how can you talk to your doctor about reducing your risk? So I want to review those over the next 2 slides with you. So some things to think about and some things about reducing your risk, as has already been mentioned, making sure you're taking your seizure medicines consistently and at the right dose and as prescribed by your doctor. And if you ever have questions about that, talk to your healthcare team. Seeing your doctor regularly, or your other healthcare providers and your epilepsy doctor, to make sure you're always following up with appointments there. Getting enough sleep each night. As I shared, sleep is important for me as it's a trigger for my seizures. So I always make sure I try to get the best sleep that I can. Identifying those triggers and knowing what triggers your seizures so you can adjust your lifestyle and environment as needed to hopefully, get rid of those triggers so you're not having, seizures as often. And then, if maybe medications aren't working for you, talking with your doctor about other therapies, maybe thinking about epilepsy surgery, or looking at monitoring devices, or even talking about dietary therapies. So there's other options if medicines aren't working, to bring up to your doctor and see, would these work for me to help reduce, your seizures and reduce your risk. Then we have a few more on the next slide. To keep you safe too, you always want to think about safety. You want to make sure the people you're with, like your friends, family, coworkers, know seizure first aid. So if you do have a seizure, you're safe. So, we offer those trainings here at the foundation and at EF Minnesota. So you can offer that training so that people around you know what to do. So it keeps you safer. Also, having your seizure response plan or seizure action plan up to date and available for those people. So if something happens, it keeps you safe to help reduce your risk. And, you want to be seizure safe, as I mentioned earlier, taking extra precautions around water. That includes just swimming and bathing, or, thinking about other accidents that might happen, just, being seizure safe and making sure you have those safety measures in place. And then also considering a seizure alert device if you have nighttime seizures, and thinking, if there's a way you want to alert someone to seizures that you might have at night. So these are just some ways that you could, help reduce your risk for SUDEP in ways to, really, you don't want to have those uncontrolled seizures. And these are some tips to help, hopefully lower the amount of seizures that you're having. And you can, have this conversation with your doctors about how to reduce your risk. And then, how to talk with your doctors. We're going to, dive deep into that now too, because that's that elephant in the room that, I mentioned at the beginning of the talk, how to talk with your doctor, how to bring up that conversation. And so let's talk more about that, because I know that's not an easy conversation to have. So I want to make sure we spend time talking about how to bring that up. So, oftentimes, I'm sure there's many people on the webinar right now where, your provider hasn't brought it up yet. That's probably why you're here, to learn about how to bring it up with your provider. So, just how SUDEP isn't easy to talk about for us as patients, it's also not easy to talk about for doctors, nurses, and other healthcare providers too. So one reason is that, still we don't know a lot about SUDEP, as I shared previously. And we know about some risks, as I shared, the uncontrolled seizures at night, but there's still not a lot, that we're not sure about. So, here are a few reasons on the slide why healthcare providers may have difficulty talking about SUDEP. Talking about death in general is challenging, and bringing that up during an appointment is hard to do. Finding the right time to bring that up, is it when you're first diagnosed? Is it later on? Finding that time is challenging. Not knowing if the patient's ready to hear it yet, if the caregiver's ready to hear it, if it's going to be too upsetting. But as I shared, I work with a lot of providers who know everyone needs to hear about it. We need to be educated about it as patients. And they're working with other providers to say, we need to educate patients and families about this. So it is being educated in the community and talked about in the community. So it is being worked on, which is, a very awesome thing, because more and more providers are talking about it with patients and families. So I'm kind of probably wondering now, should I wait for my provider to bring it up? It's a very good question. And the answer may be different for different people. Some people, like to know everything as soon as possible after they're diagnosed. Others need time to digest that information. In general, it's time to ask questions, and who better to get that information from than your healthcare team, who knows you and knows your epilepsy really well. Getting used to a diagnosis of seizures or epilepsy takes time. As I shared, I'm a person with epilepsy. I've had it for over 18 years, and there's always new things to learn about your epilepsy. I didn't learn about SUDEP right away, and I wish I had. It took me bringing it up to my healthcare team and asking those questions to learn about it. But the conversation went really well, and they were really grateful that I brought it up. And they were, we were able to have a really good conversation about it. And I wanted to share some, tips on this slide about, when you're thinking about having the conversation with your healthcare team, kind of how to prepare for that. So as I shared, it's a good time to ask questions if you're thinking like, should I bring this up? Because it's important to get that, information from people who know you and know information about SUDEP really well. So talking about SUDEP will take time. Those doctor's appointments can go quickly. So you don't want to bring it up at the end of the appointment when, maybe the appointment was running late already and kind of rushing around, because you want to make sure you have enough time to talk about it. So tell your doctor that you have questions and that you want to talk about it, so that you have enough time and the doctor knows you will set enough time aside to talk about it and address the concerns that you have. And you want to write down what your doctor tells you. I know I do that so I don't forget what is being told to me, especially a conversation like this that can be stressful and hard and difficult. You don't want to forget what they're telling you. And, maybe you're wondering, well, what do I ask? What questions do I ask? So we have some questions you can ask on the next slide when you're ready to talk to your healthcare team about SUDEP, because it's really important to have those questions ready in advance so that everyone's prepared for the conversation. So you want to make sure you know some general facts about your seizures and epilepsy, so it's easier to have this conversation. As I was saying, what's the greatest risk factor is those generalized tonic-clonic seizures. So making sure you know what kind of seizures do you have? Are they at night? The frequency. So you understand those basic facts about your epilepsy so that when the doctor is having this conversation with you, you understand the risk factor that they're telling you and the information that they're telling you. If you don't know these basics, make sure you start there with your doctor so that you can have a really good conversation when you want to talk about SUDEP. So here on this slide are some common SUDEP specific questions to ask your healthcare team when you want to start that conversation and get that better understanding. So just to go through the questions, first you can start out with, what is my risk of SUDEP? You just ask straightforward that question. Question 2, how can I prevent future seizures? Because again, that risk factor is having those ongoing uncontrolled seizures. 3, what should I do to reduce my risk of SUDEP if I have seizures at night? Is it an alert device or, something like that? And they'll have great tips on, what you should be doing. Question 4, should I consider using a device to warn someone that I'm having a seizure? Again, the doctor will be able to really identify what's best for you as their patient. And then question 5, what should I do if I have another seizure? And they'll really help you because they know your epilepsy, the details of your epilepsy, help you give specific instructions on these questions. And you might have other questions too, and make sure you come with all of them. And we have resources available that have these questions for you that we can share so that you can print it out, have it up on your phone, whatever is easiest for you. And you can write the answers right next to them or anything like that. So it's easily available for your next doctor's appointment. But this is a good place to start when you want to have that conversation. And then if we go to the next slide, people often ask, do I only talk to my healthcare provider or should I share with others about SUDEP and the risk, whether it's high or low? Or is that, again, just a conversation for me and my healthcare team? Talking about epilepsy can be hard to do, and talking about SUDEP can be even harder. All of us, whether we have epilepsy or not, should know about our health risks so we can know what we face and how we can improve our health. Knowing if you or a loved one is very low risk for SUDEP or very high risk is powerful information to know. So it's important to talk to your family and friends about what SUDEP means to you and to them. So a few more tips to give you about, conversations around SUDEP. I feel like I've been giving you lots of tips tonight. Hopefully you're finding them helpful. Have them here on that slide that will help you stay safe. Again, if a seizure occurs and, how to have that conversation with people that aren't your healthcare team and are, friends and family. So yes, it's important to talk to friends and family about SUDEP and what it means for you. Again, talking about this topic is challenging. It's going to be challenging with loved ones like friends and family, but you want to make sure you talk with them and that, they probably know what to do when you have a seizure and all of that. So you want to make sure that they understand seizure first aid and your seizure action plan so that they can keep you safe and all of that. And that, if they're part of your doctor's appointment, that they're also educated on how to have that conversation with your healthcare team. And that maybe you can walk them through those 5 questions we just went through so that everyone's prepared for that conversation. And, just be there for them and being able to have that open conversation about, your epilepsy and SUDEP risk and all of that. Everyone will be, really understanding and wanting to be there to best support you and your epilepsy. And for the last section of our talk tonight, I want to talk about our support services that we have at the foundation for our bereaved families and individuals that reach out to us. So on the next slide, I'll talk specifically about what we have at Epilepsy Foundation of America's national office that we offer. So our strategic plan is divided into 5 pillars, but our SUDEP and epilepsy mortality activities are built across all 5 pillars. And that work supports SUDEP research, promoting education and awareness programs, and offering resources and bereavement support to individuals and families. So starting on the next slide, one of those first services is our national helpline. It offers 24/7 support in both English and Spanish, and it's available to answer any questions you have about epilepsy and seizures, and connects people to our national and local resources. So you can call our national helpline, but if you're looking for local resources in Minnesota, we'll get you connected to those local resources in Minnesota. So don't ever hesitate to reach out to us. We'll get you plugged in to what you need. And you can see on the slide here, one of those topics is about SUDEP. So if you ever have questions about that or any of these other ones, our information specialist will take your call and get you what you need. Specifically with SUDEP, we might get them, a referral to NASH, the SUDEP registry we talked about earlier, or getting families connected to our bereavement coordinators who chat with them one-on-one and offer them, one-on-one support as they're just getting connected and learning what they need and what kind of support they might need. And we'll go over some of those specific things we offer in the next couple slides. And on the next slide, some of those one-on-one support. We have our bereavement coordinators who offer one-on-one support to the individuals and families that contact us who've, it doesn't have to be someone who was lost to just SUDEP. It could be those other epilepsy mortalities we talked about, from accidents, suicides, things like that. Our services are open to any epilepsy mortality. These referrals come from that national helpline, our local offices across the country in our network, and many of our partner epilepsy organizations. Depending on the needs of the family, the coordinators will share about our variety of resources available to them and get them connected to our online support group, or, really what they need at the moment. Because families are really open and honest about what they're looking for with where they are in their grief and what will really help support them. We have found these one-on-one conversations very helpful in getting the family to feel supported and knowing they aren't alone. And we also follow up with them about every month or every 3 months, depending on the family, from the first contact. And we stay in touch in a variety of ways. One way is our angel cards. You can see pictures there on the slide. And the angel card we'll send at, when we learn of a loss. We'll also send one out at the angel date, which is the date of someone's loved one passing in our community. And it's really just a way to stay in touch, let them know we're thinking of them, instead of just, calling them or sending an email, just sending a little note to say we're thinking of them, we're here if they need anything, because we have these different ways and these different touch points we want to make with our families and individuals to let them know we're here for them and they can always reach out whenever they need anything. On the next slide, in addition to the one-on-one supports, we offer a few other things. We have our online bereavement supports. One is our online Discord server, which is designed to help families connect with others who have lost a loved one in epilepsy due to epilepsy, in a safe and confidential environment, because that's very important. with our bereaved families. We want to make sure it is safe and confidential. If you haven't used Discord before, I know not everyone has. It offers an easy way to stay in touch between our support group meetings. If you're able to create different channels, you can see in the graphic there, or topic areas, you can think of them as, that are relevant to the group. And you can see what we've created there. We have a support group one where we have, a general area, an adults area. We have one where you can connect with others, where folks can introduce themselves. And then we have an area where people can share with others. So they can share pictures of their loved ones. They can share, upcoming events. And we also most recently started a dads group, because we've had a lot of dads who have joined our bereavement support group. So they have their own section now where the dads can connect and get to know each other. And we also have a channel called Ask Others, where people can ask questions and share with each other. So with the input, from the families, we've created these different channels so that members can get to know each other better and have ways to ask questions and connect in this online community. And, as the administrator, I'm able to share about upcoming webinars like tonight's, and share about awareness activities that are interest of the group, so that they can stay abreast of educational activities. We also have one to share about books and podcasts about grief and loss. So it's a really good way that we've stayed connected with our families. And we also have our bereavement support groups. We have our virtual adult group that meets monthly, and the members join from across the country. We even have someone from Canada, and we had a family from the UK for a little bit. So we've been international. We've heard the desire for more support groups. So we're currently in the planning phase of starting a sibling support group. And our regional network also has local support groups. As Debbie shared, they have a support group for, loss. I think I saw in their original first slide there that one's coming up. And I think she said it meets quarterly. So if you, don't want to join a larger group, you can also join a local one. And if you're curious if there's local ones, you can always get that information for you. And, our monthly group has really been successful, because folks have been able to, build a really strong community and support one another in and out of the meetings. As the members learn that they live near one another, they've swapped contact information and they get together between meetings. If it's for coffee and just, we'll get together and support each other, or they just talk on the phone regularly. And, as I shared, they're always giving feedback on, what can we do to improve our groups? Do they want a speaker on a specific topic? Do they want, other things? Do they want an extra support group around the holidays? So they're very, it's a great relationship that we have with them to be able to offer more supports. And then the next slide, some more services that we offer is people were always wanting ways to remember their loved ones, and it's very important to them. So at our Epilepsy Foundation walks, we host remembrance walls as a way to remember those lost from epilepsy. These walls provide an opportunity for families to share a photo and a memory of their loved one on a small flag that's placed on the wall for others to read. And the photo on the slide here gives an example of one of those remembrance walls from a walk a few years ago. And local offices and our network offices also do remembrance walls at their walks. And we also have our eJourney campaign, where families can submit a story and photo to help educate and raise awareness by sharing their story. You can see that other photo is an example of an eJourney campaign. And we post these stories on epilepsy.com, and we use them throughout the year at different times for SUDEP Action Day or different campaigns. We actually posted one today because there was a local SUDEP Awareness Day in North Olmsted, Ohio. So their family wrote an e-journey for us, and we were able to share that information on our social media channels. So it's a way to, honor those we've lost to SUDEP and, share their families' stories and their stories throughout the year. And around awareness and advocacy on the next slide, a lot of the families share their stories because they want to help us make a difference and create change. It's a lot of, what people with epilepsy want to do. And so families want to do that in honor and memory of their loved ones. So just this past year, we launched a digital campaign called Start the SUDEP Convo with the assistance of some of these families. And it was a 6-part video digital campaign where the goal of the campaign was to raise awareness about SUDEP and to improve communication between patients and their healthcare providers, while most importantly, honoring the lives of those who were lost to SUDEP. And it was a really wonderful campaign. Partners helped us share the social media content and the videos, and we have all the videos available on our YouTube channel if you haven't seen them yet. But I want to share a brief clip from one of those videos from the Perry family tonight, so you can see just a really brief clip from one of the videos, and I'll have Debbie hit play on that for me.
Okay, so apparently some people had trouble hearing the sound. I heard it. I don't know. And Allison, you said you couldn't hear it?
I was going to say, it didn't come through for me.
Yeah, and I think Kenzie said she couldn't either. Well, okay. Hold on a sec. I'm going to, one of our other staff members is on here, Nikki Baker. I'm going to allow her to talk here. See if I can do that. Nikki, are you there? Kenzie, can you figure out anything that could make it, if I played it again, it's not very long, so I'd like people to be able to hear it. Yeah. And I'm not hearing from Kenzie. Oops. Kenzie, are you there?
Hey Debbie, I'm working on that for you.
Okay.
I was going to say,
Allison,
how about we can do this slide, and then as Kenzie's working on that, how's that sound?
yeah, we can go back to it if she can get that working, because first I could hear it, but I apparently am the only one. So
Yeah, no problem. So we'll try to go back to that. If not, we can definitely share the link with all the videos. But in addition to, all of those other, support areas we've talked about, we also offer the research opportunities for bereaved families. We help with getting them enrolled in participating in SUDEP related research opportunities, because we often get calls from families who are interested in enrolling their loved one in a study or want to do something after someone has passed, but don't know where to go. And so we have a handful of places we refer them to, as you can see on the slide here, and we connect them with many of our partners. As I shared earlier in my presentation, our helpline will often make referrals to the North American SUDEP registry. And as I shared, they do some really amazing work in SUDEP research. And so they provide, opportunities to families, to have those interviews and share the experience of their loved one and what happened to really help those researchers in moving the work of SUDEP research. So as you can tell, we have a variety of ways to support our bereaved families and individuals that reach out to us. It's important to acknowledge that everyone needs different support with their grief when someone passes. And, that'll change over the years. Some will want just one-on-one conversations with us as coordinators, and others will want to record awareness videos. And so we want to make sure that we have support services in place for everyone. So that's why we have such a variety of opportunities and services. And like I said, too, we have these at the national offices, our local offices, like EF Minnesota has wonderful opportunities too with local, groups that meet. So we're always able to connect folks with local opportunities and things like that as well. And I think we can check in to see if maybe we have that video.
Okay, I've got some instructions here, I think, from Kenzie. Let me see. Let me go back. Well, it's going the wrong direction. Hold on. There we go. Okay, hit the up. Yeah, Kenzie, I'm not seeing the choices that you're telling me that I have for music or computer sound only. So why don't we do this? Because we're not figuring out how to make that work. How about if I send that link along with the email that will be going out with their certificates, and that way they'll be able to watch it on their own.
Yeah, we can definitely do that.
Good?
Yep.
Okay.
Yeah, we have all 6 videos in a playlist on our YouTube. So we can include that in the email for folks.
Okay, I will definitely include that.
Okay. And then on this last slide here, I just wanted to share some ways you can get more information. That's our main SUDEP page on epilepsy.com. And then our helpline phone number again. And then if you have any questions for me after this, you can reach out to us at sudep@efa.org, or if you're looking to get connected to our bereavement services, or someone who could benefit from our bereavement services, just send us an email at the sudep@efa.org, and we'll get you connected to our services. And I just want to, thank you so much for your time tonight, and, for joining us for this webinar, which, as I said, is not a very easy topic, and, for taking time to honor the families who have lost someone to SUDEP. And I know we have time for questions, so want to make sure we have time to answer any questions that have come in.
Okay, well, why don't I start with the ones that have come in. What are other lifestyle habits other than quality sleep and managed medications that can lower your risk?
So some other ones, I know I, talked about those ones, keeping with those doctor's appointments. That is definitely a lifestyle, habit, because if you're not going to those doctor's appointments, you want to make sure you're maintaining those and maintaining those conversations with your provider, because they'll be able to let you know how you're doing with your treatment, and if any treatment changes need to take place. And then, they'll be able to also let you know if there's any other lifestyle changes that you can be making to help improve and lower a possible risk that you might have.
The next question says, can you repeat the name of the Discord group?
So the Discord group, as I mentioned, we really focus on, confidentiality and security for the members. So the way to join the Discord group, you do have to have lost a loved one to SUDEP or an epilepsy mortality. So if you'd like to join the Discord group, do email us at thesudep@efa.org, and I can get you the name and the link to we just have a very simple verification process, but a verification process because we want to, make sure the confidentiality and security is maintained for that group.
Great. I encourage people to continue to type your questions in. We do have time here for Allison. I mean, she's a great resource, so we want to take advantage while you're here. I do have a few things that while we're waiting for people to type questions in that I'd kind of like to know. You had mentioned, I had always heard that young adults were especially at risk. And you had mentioned that now they're saying that both adults and children are both at risk and that one not more than the other. So is that then no longer true, or is it not that it's their age that puts them at risk, but maybe some of the lifestyle factors that sometimes young adults engage in, like not getting enough sleep, not taking good physical care of themselves?
Yeah, so it's not like I had shared. Now, more research being done is showing that age is not necessarily a factor. Because it's been harder to identify a SUDEP in a younger person, an infant, toddler, compared to an older person, just with autopsies and things like that. So that's a lot of the research that has shown like it's equal with adults and children, but looking at age, a factor, like you were saying, is, maybe more young adult type age, because that is often a lot of the families that we hear from tend to be teenage to, late 20s, early 30s. But they don't necessarily look at that as a risk factor, more so type of seizure and those other, like I was saying, lifestyle factors that were mentioned, but not necessarily age being a risk factor.
Okay, great. We have a question here. Please speak on diet to decrease chances of generalized tonic-clonic seizures. Again, that may be more of a medical question. She's wanting any.
Yeah, I would encourage you to talk with your provider if keto would be something to help with your seizures specifically. Yeah, I would talk to your doctor about, that specific treatment for your seizures.
Yes, and that was her follow-up also. She had the same person, is the keto diet recommended? So it's going to depend on the individual. It's not like diet is a general way to avoid SUDEP. It's more, is keto or some other diet going to be something that might help a specific individual reduce the number of seizures, which then would reduce their risk of SUDEP, correct?
Yeah, and you can talk to your doctor, as I shared, about, if medications don't seem to be, helping your seizures, asking your doctor, like, is surgery maybe an option for me? Is there a dietary option? Like, bringing that up, and they'll be the ones who know, like, yes, keto might be an option to try, or yes, let's do a surgical evaluation. Like, you're allowed to ask those questions of your provider about other treatment options that could assist.
Okay. We at EFMN fairly often get people calling, particularly parents of teenagers or young adults who maybe their doctors haven't talked to them about SUDEP, but the parent heard about it and they're trying to figure out how do I talk to my child, my young adult child, about the risks and about what SUDEP is without scaring them or without getting a negative reaction in terms of, oh, mom and dad don't know what they're talking about. So do you have any tips at all for talking to family members who may be at risk?
Yeah, so some tips like kind of talked about tonight is, just not, like you were saying, not like throwing all the information at them because it could be scary. And, just sitting down and having that conversation, having some information and, you can even phrase it as, here's some things that, make sure you're doing because, your seizures, you want to make sure you have better control. So I know some families I've worked with and some others frame it as, making sure you have the best control of your seizures possible, because, some bad things can happen if you don't have the best control possible. So making sure like you're taking your meds and, depending on the age, if it's a teenager or whatnot, like giving them some, control of like, make sure, taking ownership. Sorry, that's the word I was looking for. Ownership over their care. Because having that ownership and knowing they're having the best control, I know has worked for a lot of, young adults or teenagers to, not scare them when that conversation is happening, because they know like, well, I'm in control. I can reduce my risk because I'm doing these things I'm supposed to be doing. I know that doesn't work for everyone. Teenagers don't always want to do that. But it's really just, individualized too. So if you have to have the doctor have that conversation, or, if there's a trusted individual in their life that's not a parent that, they really are bonded with, like bringing them into the conversation and something like that.
Okay, that's a great idea. And I think especially with teenagers and young adults, offering them that control, that it's not, I'm telling you, you need to do this, but here's something you can do to control your risk rather than someone else imposing it on them, maybe.
Yeah.
That's good. I had a question about research with SUDEP. Would you consider that there's adequate funding for that, or are there efforts to increase funding for SUDEP research?
There can always be more funding. I will say that. Always more funding for epilepsy research in general, and specifically SUDEP research. There's been more funding recently with American Epilepsy Society putting out some grants, or other, organizations putting out grants. So there has been some more efforts around SUDEP research funding, but as I shared, NASR is one of the big groups, but, Partners Against Mortality and Epilepsy, or PAMI, is another large partner that focuses on research, and, research is being done internationally around SUDEP. So there's a large amount of people focusing on this, but there's always more funds that could be put towards something like this.
Okay, great. Okay, it looks like maybe we have gotten a question here. Oh, okay, someone's asking about the PowerPoint. They must not have heard at the very beginning. Yes, I did mention at the beginning that the PowerPoint that you are seeing tonight is going to be available. If you were at this webinar, you will receive an email within the next couple of days with your certificate of attendance, and we will also be including the PowerPoint, so that yes, you can share that PowerPoint and look it over with other family members, which was what their concern was, that they wanted to be able to share that. So yes, we want everyone to know about this. So I also had a question. I'm just going, well, let me see. Is there another one? I'm just going to keep asking questions if no one else does, because I just think this is just such an important topic. How well-informed are neurologists in general, and I'm thinking particularly about general neurologists as opposed to maybe an epileptologist. Do you find that they are pretty knowledgeable about SUDEP, or does the level of care you're receiving maybe have an impact on the likelihood of your doctor being knowledgeable and bringing it up to you?
Definitely the latter. The level of care increases, if it's going to be brought up. We have efforts being done to educate not, just epileptologists having these conversations, but general neurologists having these conversations and being knowledgeable about SUDEP. Because we know people with epilepsy see a variety of healthcare providers, and we want to make sure, everyone is knowledgeable about SUDEP. So, yeah, we want more people knowledgeable and talking about it. So, everyone is comfortable talking about it.
Okay, great. And I think especially for people who, I think it's important to remember that people, especially who are not well controlled, whose seizures are not well controlled, and perhaps have not been well controlled for a long time, if they're not already seeing an epileptologist, it may be time to step up to that level and go to a comprehensive epilepsy center where there is more specialized knowledge.
Yeah, as I shared, as a person with epilepsy, I've only been at a comprehensive epilepsy center for 5-6 years now, but I've been living with it for 18. So it just took a while to learn there was an epileptologist. And yeah, so there's definitely, people that, you want everyone to be knowledgeable, their healthcare providers.
Okay. And I'm going to ask one more before I go into my wrap up, since I don't see any other questions that have come in. And oh, wait a minute, maybe there is one here. Okay, yes, there is. So we'll leave mine. This individual says, I believe you mentioned that sleeping alone can be a higher risk for SUDEP. Would you recommend sleeping with your child to reduce risk?
So this question comes up a lot, and co-sleeping is not necessarily recommended. But that study did say, that risk does increase just because you don't possibly hear the seizure or for different reasons. I would talk to your provider about that to see if they would, recommend that, because it could be, maybe there's a seizure alert device or monitoring device that you could use instead of co-sleeping. So there's other devices and things out there that can alert you to a seizure versus, co-sleeping with your child, because depending on the age of the child, that could, as we were talking about teenagers or things like that, might not be the best step or environment for co-sleeping. So really could talk about those seizure alert and monitoring devices.
Okay, great. And then one more did come in, so I'm going to try to sneak this in under the wire here. From this, and this will probably be the last one we'll be able to take. From the study of those who died from SUDEP, of all of the related underlying epilepsy conditions, for example, juvenile myoclonic epilepsy, have they discovered any mechanisms or connections of how this happens for any of the conditions?
So that is part of the important research that needs to be done and continue to be done, like you were asking about SUDEP funding. So this is ongoing research from NASH. Now that they identified that, other research are looking into those areas because they want to identify that to see, is it higher risk in some of these types of seizure or epilepsies or rare epilepsies? So people are working on that. So there's no clear answers on that just yet.
Okay. I'm going to sneak one more in since it came
Yeah.
in. But then I think we are coming up on the end of our time, and I do have a little bit of a wrap up to do. What can a person do if they witness a seizure happening at night to prevent SUDEP?
So that is a very specific question because it depends on, that person's seizure and how it is at night. like I have nocturnal seizures, but I have focal seizures. So, you know, there's nothing that needs to be done since those are my typical seizures for that. So it really just depends on, you know, how that person's seizures present. Like I answered that other question, you know, maybe it's having that device at night that alerts a person that a seizure is happening. So I would, you know, talk with your healthcare provider about, you know, the nocturnal seizure to see, is that putting me in the high risk for SUDEP? If so, what are things that I can do to help, you know, put me into that lower risk category?
And if they do get a device or whatever, and they see a seizure, talk to the doctor about how should they respond to that.
Yep, exactly, because everyone's going to be different in that response.
Right. I don't think that can be emphasized enough that, you know, your doctor is there to help you and to serve you. And if you have these questions, don't be afraid to ask your doctor. And if you don't get an answer, ask again.
Yep. And then I know I've mentioned devices a lot tonight. One of the organizations I know we all work with a lot, the Danny Did Foundation, does a lot of work with devices and helping families get devices. So you can always look at their website and contact them, and we can put their information in the follow-up email too, to learn more about specific seizure monitoring devices around SUDEP.
Yes, and I will mention that in that email, Allison was kind enough to provide me with a number of resources that I will be including in that email. I think someone had asked earlier about whether whether some of the information you were talking about is available elsewhere, and I will include some of those resources so that people have things to refer back to.
Cool. Thank you for doing that.
Great. Okay, well, just a, quick wrap up here, a reminder that EFMN leads the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. That is our mission. I want to put in a really quick plug for our information services. Allison had mentioned the National Helpline, which is a wonderful 24/7 resource. Our information services is not 24/7, but we are here to offer free one-on-one support during business hours. We really work with people where they are to try to customize the tools and the resources and the referrals that we give them so that, we're talking about SUDEP tonight, but if you have any questions at all related to epilepsy, please don't hesitate to reach out to us, because that is what we are here to do, is to answer your questions or to point you in the direction of where you can get those answers. So, and the assistance that you need. So we encourage you to reach out. There's a form on our website that you can fill out, and we will respond to you. I want to also remind people that our next, and this will be our final Wellness Wednesday webinar of the year, will be on November 30th on the topic of psychogenic non-epileptic seizures, or PNES. And we are really excited that we're going to have Dr. Julia Doss here to speak on that topic. She is just a nationally known authority on PNES. So we're very excited about that. So go to our calendar and register for that. Register for any of the other Connect groups or events that are coming up. Once again, I want to thank Allison for being here. This was very informative. I appreciate your taking your time on a Wednesday night to come and talk to us. And again, thank you so much. And I want to thank everyone else for attending as well tonight.
Yep, it's my pleasure. It was so much fun. I'm glad everyone can join us tonight. Thanks for having me.
Great. And I'll just say, everyone, just have a good evening.